So today we're going to be talking about rosacea and vascular applications using the Fotona SP Dynamis and Fotona QX Max. We're the oldest Fotona users in Australia, which we're 4 years old, so we're still very new to this. So rosacea, it's quite a difficult topic to discuss because, as we know, there's a lot of facets to rosacea and it can be very difficult. It's more of a management rather than a cure. What is it? So rosacea is a chronic skin disorder characterised by facial flushing, persistent erythema, edema, telangiectasia, and inflammation in pustules and papules. The reason, as we said, it's difficult to treat because it's a chronic condition and it can relapse and it can also spontaneously clear. So it's difficult to, give an indication of how good a result the patient can receive. And we know it's a big issue because even some of our emojis have rosacea now as well. We can see redness on the cheeks in even some of our emojis. 4 stages of rosacea. So as we know, there's 4 different stages of rosacea. Generally speaking, with our lasers, we target the first stage and also the second stage of rosacea. So the first step, so looking at facial redness and facial flushing, we can see that it can change the appearance of the skin by dilated blood vessels and overall redness of the skin. Bumps and pimples of the skin, pustular rosacea, enlargement of the nose, so runiformia, and ocular rosacea, so eye irritations. Treatment options for rosacea. So generally we used to treat with oral antibiotics, topical agents, internal isotretinoin, sclerotherapy, laser, and surgery for runiformia. Over the years though, rosacea has been treated with lasers since the 1970s. And we've advanced by treating with different wavelengths, spot sizes, and variable pulse durations. Since then, the laser treatments of vascular lesions has become safer and more effective. When it comes to treating rosacea, we have to understand what we're treating. And obviously, we're treating generally blood. What's the depth of the blood? Is it superficial or is it deep? In our experiences, you can have both. How big is the target? So as we know, we can treat with different spot sizes as well. Positives of treating rosacea. It's a quick treatment. It's an effective treatment. It's a treatment that requires less judgment or experience than, as we saw, the vascular lesions. So it is something that your nurses could potentially do as well. And also patients are grateful to be seen. We find that a lot. We get patients that have been to multiple clinics and they're just happy for any solution. In Australia also we have Medicare item numbers as well, so it is a claimable treatment and it's a treatment that poses little risk if used correctly. Negatives of treating rosacea is that there are many factors and contributors to the condition, so it's hard to, pinpoint what the actual cause is, and also, again, this is difficult because the patients can get a varied degree of improvement. Obviously, it's important to establish this at the time of consult, that there are obviously those variables. So how do we like to treat rosacea? Well, we break it down into 2 different categories, which just makes it easier when explaining it to our patients. So the first treatment is R3. So we call it R3 because it's a treatment for rosacea and 3 different treatments combined in the one day. So we start by treating with a FRAC3 ND-YAG laser, and then we treat with an ND-YAG pulse laser, using generally a large spot, a 9 or a 6 mil spot. Then we follow with a Q-switch KTP. We have a QX Max, so we use this. You could also use an IPL as well, which we have done as well. We have a Harmony Light. So why would you treat with R3? You treat with R3 because diffuse redness, inflammation, deeper and more superficial blood, chromophores. The other option would be targeted ND-YAG. So as we can see, more telangiectasia present on this patient. We would use a small spot size, and we would do this because there would be visible localized vessels. So the absorption of light, we know that with rosacea, we're targeting the oxyhemoglobin in the body. FRAC3, so we know that this has been around for a long time with Fotona. It's fabulous because it works by creating a pixelated, non-ablative 3D photothermal effect in the skin. So R3. So what is R3? So it's a non-ablative laser treatment using the Fotona SP Dynamis, using the 3 different multiple modalities. It's a protocol that uses conservative settings, so this could be tailored to be more aggressive for experienced users, or if you were having your staff perform this treatment, you could give them more conservative settings. Results shown to improve in redness, and also the texture and tone and the clarity of the skin can be improved as well. We would usually recommend to perform the treatment as a course of 3 and then reassess. Obviously, at this point, you could choose to do more treatment if this was required as well. So why R3? Diffuse redness, photoaging, sensitized skin, so we want to strengthen their skin before we look at doing targeted ND-YAG. No targeted telangiectasia, so as we know, the ND-YAG works quite well because it has a targeted vessel, so we need to sort of clear a lot of this diffuse redness in the skin. Poor healing, so if they have very frail skin, they might be older or immunosuppressed, it might be dangerous to treat them with a targeted ND-YAG. We'd perform it as a course, and we'd space the treatments generally 4 weeks apart. Post-care, we always recommend an emollient cream and obviously an SPF. Being in Australia, we have a lot of sun. And it can be completed with follow-up treatment of telangiectasia treatment with the pulse ND-YAG for visible vessels. So here's some of our cases. So this is after 3 sessions of R3 laser. We always like to put all of our rosacea patients into our Visia machine as well, just simply so we can show them the red areas. So these are the treatment settings that we've used. She also complained of soreness and she had visible pigmentation as well. And we can notice in the first picture that pigment on her cheekbone has improved as well. It's important to note as well that we also use adequate cooling when we use the R3 method, simply to preserve the epidermis and to make sure that burns and the safety of the laser is improved. After 5 sessions of R3 laser, interesting photo in the Visia, you can actually see she's recently had her eyebrows waxed and nice and red across there. However, we can see a huge improvement, particularly in her cheeks. Again, this is increasing the energy settings used with the KTP can also be demonstrated as well. After 3 sessions, so again, complaints of not only redness but also pigmentation and general aging. You can see a big difference in her pigment on her temples again. Also, you can notice a difference under her eyes. It just looks a lot tighter and a lot fresher. So she's extremely happy with the results. In her Visia photo, in the red areas, you can also see a big difference in her cheeks. I should note as well, we also combined Q-switch ND-YAG for this patient as well, which was used predominantly for her pigmentation. After just 1 session of R3 laser, so this is here to demonstrate as well that you can treat more aggressively if the patient is happy for you to do so, obviously. And this patient, she travelled a long way, so we actually treated her quite aggressively with more energy with our KTP. After 2 sessions of R3, so again, complaints of just overall clarity of the skin not being very nice also, so she's had a good improvement, not only with her redness, particularly on the nose, but also with her pigmentation. And her overall clarity just looks a lot better. She looks a lot fresher and younger. After 2 sessions, so again, the patient complained of redness, but also soreness and just general aging. She also had some seborrheic keratosis lesions as well that we've since treated as well. After 2 sessions of R3 laser, using this on a male patient, at this point, I would ideally like to treat him with targeted ND-YAG. You can see there's a few visible vessels on his nose when you look at the Visia. However, he was really happy with his results, so he chose not to proceed with further treatment. So targeted ND-YAG. So this is using a small spot and a high fluence. So why targeted ND-YAG? Well, we want to use this for visible localized vessels. As we know, the best clients to treat targeted ND-YAG are those with really juicy, visible vessels. They respond the best. Usually performed as a course, and again, dependent on severity of the vessels as well. Treatments, you want to space them 4 to 8 weeks apart, depending on how aggressive you treat and how long it takes the patient to heal. Post-care, again, just using an everyday emollient cream and an SPF. Adequate cooling obviously needs to be used when treating with targeted ND-YAG. We generally use ice packs, but you could also use the cold tip devices as well. And that's just to ensure not only burns, but also patient comfort as well. So considerations when using targeted ND: how deep is the vessel, how thick is the vessel, and how much energy do you require? These are all really important questions that you need to ask yourself before you treat. So after 2 sessions of targeted ND-YAG laser, so you can see particularly in her Visia photo, she's got very visible, nice juicy vessels on her cheeks, and we've treated her using a low spot and higher energy and moderate pulse duration. After 2 sessions, so we can see in this patient, she's also had a big improvement in her diffuse redness after having the targeted ND. After 2 sessions for a male patient, again, he's had a big improvement. Generally, I would recommend further treatment, particularly for his nose, but he was really happy after these results. After 2 sessions again, so it works quite well around the nose as well. We find a lot of people come in with different vessels around the nose. After 2 sessions again, so we want to increase the energy as well if it requires, and we can alter the pulse durations as well. So in summary, the R3 is used predominantly to treat diffuse redness with no standout telangiectasia, and pulse is used for visible targeted telangiectasia. The SP and the QX Max can be used with very positive results in combination and on their own. And it's very great to combine them when we are looking at the treatment of rosacea and vascular lesions. Pulse duration, spot size, energy can all be tailored to suit the individual patient, and the treatments are quick to perform and high patient satisfaction, so it's a great treatment to perform. Thank you. These are just some slides of our clinic in Melbourne. And if you're ever in Melbourne, do come visit us. We've got some great attractions. So beautiful beach lines and lots of kangaroos.